hope by God's grace, our journey this year will be smoother than that of last year by God's grace. Like the director had said, that whether we like it or not, all the stages of hemophilia, most especially hemophilia, all the stages of their life, whether we like it or not, the physiotherapy is involved in all these phases and stages. So it is very important for us to understand all this. As time goes on, today is our first lecture in the year, so that we can try to familiarize ourselves with the modus operandi, how we're going to be doing it, so that we can have a clear picture of everything we are doing. One, for the people living with hemophilia, and secondly, for the professionals involved, most especially now, the physiotherapists that are new or relatively new to the management of physiotherapy, they are relatively new to bleeding disorder generally. It's so straight and simple. Once we follow the guideline strictly, because it has its own guideline. Luckily for us, the WFH is always updating the guidelines of treatment for all the specialists involved in the management of hemophilia and its complications. Then luckily again, in Nigeria, we have our own guideline. The updated version, I'm very sure, is out. So as time goes on, but one thing, my major message to the physiotherapist this time around is, when you are managing people with hemophilia or other bleeding disorder, number one thing, at this phase of our development in the history of Nigeria, whether I would like it or not, it is just a call to service. It's a call to call service. You must have it at the back of your mind that everything you are doing, I can assure you of that, for now, is sacrificial. At least that aspect of life that you want to impact positively in the lives of this community, it has to be with commitment, not for any gain for now. But the good thing about the gain is that you are happy helping a group of people, and you are seeing them, you are seeing their lives being transformed by your own skill and commitment. So today we'll move straight. I think the director had some pre-lecture questions for all of us. I'm very sure in the meantime, our director will help us display those questions.
Okay,
so that
sir.
this will be a kind of guide for all of us, so that as we are moving, we know whether we are improving or not. So those areas that we have to emphasize more on, then we can put that. Now, for today, we still do a kind of brief introduction. Like director has said, we have it's a multidisciplinary approach, which we refer to as comprehensive care. Is available.
When do you want me to, let me know when you want me to run the poll.
Yes, I think it's good now, ma.
Okay, sir. Let me know.
Yes, it's good. It's good now. It's good to run the poll now, so that
we have this poll. Please, want you to answer. I wish we had more people already in, but currently we have, if I minus myself and Dr. Kareem, we have 32 people. So we expect to have 32 answers. So I'm launching it now. You will see the questions on your screen. You are to pick one. And I hope you can see it. We have just like 2 minutes to answer the poll. The first question is, which chapter do you belong to? We all know we are in one chapter, so just pick your chapter. The second question is, how much will you rate your current understanding of how hemophilia affects joint health and mobility? Do you have limited knowledge? Do you have moderate knowledge? Do you have high knowledge? There's no right or wrong answer here, please. It is just for us to know where you stand and to help us in tailoring the training so that we can actually achieve more. So just tell us exactly. If we have very limited knowledge, then we know that we have to start. If we have people with high knowledge. So the next question is, have you experienced any joint pain or mobility challenge in the last month, in this past month? Yes or no? And the next question is, which area would you like to focus for us to focus on during the next 3 months? Joint flexibility, strength building, or pain management? The next question is, do you currently have any exercise routine? Yes or no? If you have, how comfortable do you feel with the current one? If you don't have, then you pick not applicable. If you don't have any exercise routine, it means your answer for this last question is not applicable. So please, let's just answer. Like I said, there is no right or wrong answer. The answers is just to guide us in what we are going to be doing. We have less than half of us that have answered. Please, let's answer the polls. It's very, very important. We only have 15 people that have answered, and we have like 35 people here, or 34. If I take away myself, Dr. Kareem, Nurse Florence, and our VP Medical that has joined, that means we expect to have 34 answers here. So please, let's try and answer.
After answering, can you submit, please? Can you press submit?
Yes, once you answer, you submit.
Just submit.
Yes, once you answer, you just submit. Once you have selected, submit. Thank you.
Okay, I have submitted. Thank you.
Thank you. Thank you.
Any gift for the first to submit? Any prize for the first to submit?
Yes, Dr. Oju, you will send data of the 10 gig to me after the meeting. That's for being the person to ask that question. That's what you will do.
I'm asking if there's a gift for the first person. You're telling me to bring 10 gifts.
I know you are the first person to answer. Let me use this time to welcome our VP Medical. I saw her when she joined in. Professor Waha, you are welcome.
Good morning, everyone. Good morning, ED.
Good morning.
Good morning, Dr. Kareem. I'm really happy to be here. And we have quite a number, though we are hoping that more will join in before the program really starts. I posted something on the chat. Please, if we have any physiotherapists from our HTCs, can they please identify themselves and the HTC they are coming from? Yes, Thank you.
There was one joined already. He came in very early. I don't know.
Identify yourself on the chat, please.
Yes, we're almost done. Please, when you select, you have to click submit so that we can be able to have your answer. We have 25 out of 36 people that have answered. Please, the poll is still up. Let's try and answer them, please. We need these answers to guide what we are doing. There is no right or wrong answer.
At all.
Every answer is right. Every answer is needed. So please just tell us exactly where you fall, the category you are, and then we'll be able to know how to better help us. Thank you. I'm going to give just a few more seconds and then we'll end the poll. No, we don't have everybody's response, but we just have to end it so that we can continue. All right, so. Now this that's the results that we have. And from the 27 responses that we got, the Southwest chapter has highest participants, 41%. On the question of how you would rate your current standing, we have 59% who said is moderate. So they have some kind of knowledge about the understanding of how hemophilia affects joints. So at least more than half of us understand, and about a quarter have very high understanding. 70% have experienced pain in the past month. Professor Waha, Dr. Kareem, I think this is something for us to consider.
Yes.
Also, area, we have 59% wanting more on joint flexibility, followed by pain management, then strength building.
Okay.
63% don't currently have any exercise routine. So that's showing us that our people are not doing exercises. So I'm not surprised that we have not applicable more, because 63% don't have any exercise routine. So that's the answer, so sir. The floor is yours to continue. Thank you, sir.
Okay. Okay, ma'am. Well, this is very revealing, and it's a good one, so that we can have where we are going to focus this year. And I'm very sure with this revelation this morning, this will help all of us a lot, from our hand as a musculoskeletal expert, and to the people living with hemophilia, to help them, especially in the area of joint flexibility, and not having a program. So what we are going to adopt this year, well, we are all free to contribute to that. But one thing in my little experience with people with hemophilia and bleeding disorder is that number one is that anything that affects walking, pain is pain anytime, any day. Then independence, quality of life, they are very crucial. So anything that affects them to walk will be taken as a very serious priority here, so that we can have a kind of bottom to top approach. So I'm just suggesting that this, from this starting point, we may need to focus on the lower limbs. That is from the leg to the waist, then later from the waist to the head. Then we'll be talking about the hands, the spine, the neck, the wrist, the elbow, the shoulder, and the rest of it. So the weight-bearing joint, most especially the two legs, as everybody will refer to it, but professionally we say the lower limbs, so that an average person living with hemophilia or bleeding disorder will be able to walk, whether we like it or not. We want to use the convenience, we want to get to the toilet, to the bathroom. The children, they want to go to school. Even as that, they still want to play. So once independence is there, well, I think the quality of life is boosted. So on this note, we would like to focus more for now. Then at the end of today, in collaboration with the director, the ED, and our VP medical, that will now sit down and draft something that will be very impactful for everybody. So, well, as we've had, we have bleeding. And once there is bleeding, we have swelling, we have pain. After that pain, we have limitation in the function. After limitation in function, we start having a lot of problems with movement. And once there is problem with movement, we start having challenges with independence, quality of life. And the first thing that will always appear after any episode of bleed is flexion. Flexion simply means the patient tends to bend. The patient tends to bend in the direction that is most comfortable. Now, and once they bend in the position, to the physiotherapist, they flex. And our first target in the lower limb is the knee joint. The knee joint, followed by the ankle, then we now move to the hip joint. Because one, it's a weight-bearing joint. Two, the muscular support is not as big as that of the hip. And three, it has two major range of motion, extension and flexion. So it is understandable that the knee joint will be the first, followed by the ankle, before moving to the hip. So once we have this, once there is a bleed, the first port of call is our hematologist and the nursing station. I'm very sure most of us, I'm happy we have moderate, we have higher percentage, we have the highest percentage that has moderate knowledge. That moderate knowledge is sufficient enough, but we aim at the high knowledge about hemophilia. It's very, very important for self-help and for self-care, whether we like it or not, because we continue to aim at the best for people living with bleeding disorder in our environment. So as we view it, the first port of call, the hematologist, the nursing station, immediately the bleeding is arrested. At that same time, we start physiotherapy immediately. And what I mean by immediately is that at that acute point, once a bleed is reported and the bleed is arrested by the hematologists and our nurses, the next thing immediately is the physiotherapist, because at that point in time, that is the best time to prevent problem. That is the best time to prevent complications. Now, as time goes on, I will dig deep down into how this will start occurring. Of course, we are familiar with the information that once there is bleed, there is swelling, there is pain, there is discomfort. The patient is so, or that person living with hemophilia is so irritable. He does not want anybody to, any person to touch that spot. It's not moving, it's just there. Then this period, we have what we call micro contracture. That is micro, in the layman language, you can say micro stiffness and shortening of the soft tissues around that area. And that is why it is not surprising that on the poll on what do people living with hemophilia, what do they need? They're saying exercises to improve flexibility. And now I'm happy, but there is a development. Before, what we have is pain management. But now, it's flexibility that is taking the lead. Why? Because at the end of the day, that patient will not be able to fully stretch out the knee joint. And the next thing that follows is that then you have this funny gait, a kind of hopping. Well, in physiotherapy, it is called antalgic gait. Antalgic in the sense that bearing weight shortly on that place is painful. So the patient wants to always, people living with hemophilia will need to bear weight for a very short period. So they tend to hop. And in some instances, the parents or the carer will have to be backing if they are toddlers and children. So they won't even want to bear any weight. So at that point, what is the first role of the physiotherapist is positioning. And that is why it is important that in our HTC, we are still committed to our guideline of multi multidisciplinary approach. We come together immediately. There is this bleed arrest, then the physiotherapist is invited. So the physiotherapist knows that the position of comfort is always against the position of function. And at that point in time, we can modify by positioning that patient, supporting with pillows, soft materials, to have what we call a mid-range positioning, so that we are not going to have excessive flexion and we are not going to have excessive extension. In that position, it will be very, very easy for the patient to return to the normal range and preventing microcontracture, which will eventually translate to macro contracture. So what I'm saying in essence is that once the patient is appropriately managed at the active stage, the patient will not need to be folding the knee joint. So the usual sight is that they will fold, they will not be able to walk. But it is very imperative that we should know that even as we are positioning, it is not a phase to start moving that joint. For people living with hemophilia, we know you have to rest that joint adequately, but it must be adequately positioned to prevent complications. If this is done on time, then we can arrest the bleed and arrest further complication simultaneously. But if this is not done, then the journey of complications starts. From that, by the time we start having this microcontracture and we have repeated episodes, the patient or the people living with hemophilia is trying to walk, is trying to bear weight. Then you have a new cycle of bleeding, re-injury, re-inflammation. And once this continues, we now have a cascade cycle of inflammation, pain, weakness, swelling again. Despite factor infusion, despite all efforts to arrest bleeding, because the appropriate thing has not been done. So once this is done, the next phase is to the cycle of inflammation, then automatically we can slow down the rate of degeneration, which eventually will take us to arthropathy. And that is what we don't want. We don't want that, because we want the quality of life of our community to be on increase, not on reduction. So what I've said now, we'll still do a few practical sessions, so that what I've just talked about especially focusing on the knee joint, because it's a major place. Now, it doesn't still mean that we don't have challenge on the ankle. We can have challenge on the ankle joint and as well on the hip. But today, for introductory purpose, and because I'm suggesting that anything that impedes our movement will automatically reduce quality of life. Are you with me all, please? Hello?
Yes, we are here with you.
Okay. So on that premise that anything that will impede one's movement will immediately reduces one's quality of life, because immediately you are unable to walk, or you are not unable to walk properly, then there is a lot of psychological problems. Even at the end of the day, it can lead to depression, that, oh, who will now be carrying me? Who will be doing this for me? I want to go and play. For the children, it has detrimental psychological effect on them. They want to play. with their mates. They want to go to school, they are missing classes. They start thinking on their performance that they are missing classes and all that. So we want to prevent this cycle. So the first thing, once there is bleed, and if you attend the chapters meeting regularly, you will be ahead in terms of information and what to do once there is bleeding. One thing this year that I'm very sure of, so our ED2, you are hearing me, ma, even though we are still going to have a private chat, this year, we are going to, let's just, if we can, the way we are starting, let's take it down to December that way. I'm very sure by the time we are posting another poll question, by God's grace, next year, January, it will be a different result. I'm very sure of that. So still in line with our joint affectation, once that one is prevented and pain is controlled, we are all familiar with our RICE application, RICE. So positioning, that is where RICE comes in. RICE, rest, ice, compression, but our compression is modified, and elevation. Very sure all our chapters, we are doing this regularly to educate our bleeding community about the first thing to do as a parent, as a person living with hemophilia. So once we do all this, and once we see that what we are doing is not working, and there is one thing about this community that I like, we respond rapidly. We respond rapidly. Even in my own base here in Lagos University Teaching Hospital and College of Medicine, University of Lagos, even if I am so busy, once I hear from Hemophilia Foundation, if that person, if I'm not saying it, you can just raise up and counter what I'm saying. Once I hear it's from Hemophilia Foundation of Nigeria, I will call that person myself. That, oh, what is happening? Okay, we can have an arrangement. It's either you meet me in the clinic or you do this, go and do this immediately. Go and do this. If you are not clear, call me again. You can have a video call or video chat with me so that we are consistently ahead of time, ahead of information, and to help our community. So on this premise, what we do now, I'm seeing somebody now. Every of our people living with hemophilia, I want to see if you're having knee joint challenge. Let us see the number of people that have their children or they themselves they're having knee joint challenge, either bleed, pain, contracture, inability to walk properly, or not walking, or if there is any episode of fresh bleed. So we move to that now. Let me see you all.
Is it by show of hand? Should they do that by show of hand if they have
show of hand? Then we now take it one after the other, the video, so that we can do a bit of practical now.
So if you have a difficulty with your knee, you have to show your child has difficulty with the knee joint. We are specific with knee today. Knee joint, whether you have a current bleed or you have stiffness in the joint, inability to walk. That's the question the doctor is asking. You do that by show of hand.
Good. Okay. Beautiful. I can see about 1, 2, 3, 4, 5, 6, 7, 8, 9. So we have 9 So good. Let's begin one after the other so that we can cover everyone. So I think we can start with, I can see Folawi. So let's start with Folawi. So let's see the name in video. Folawi. Then followed by, yes, Folawi, followed by Muhammad Kenneth. So I'm giving number now. Folawi number 1.
Oh, sorry, sir. Good morning, sir.
Good morning.
Yeah, sorry, we couldn't do the video that time, but it's something we had recently.
Okay.
Yes.
Okay.
Is he with you now? Is the child with you?
Yes, he's with us.
So he wants to see
the
knee. So if you can turn on your video and let him see the knee, that's what he's asking.
Though the old joint is lesser now, but let me just bring him.
Just bring him, please. Bring him. It's better that way. That's the essence of this program. It's not just talking. In fact, last year, majorly we focus on practical class. Once we start with practical class. But because today is the introductory class, that is why we are doing this. Subsequently, we move straight. Well, I've given you information ahead of time, and we move straight to the practical class. Okay, is that Folawi? So let's see now. Okay. Can he stand? Let me see him standing. Okay. Okay, let him walk a bit. Let him. Big boy, how are you? How are you? Okay, so this is still fair. That is the right knee joint. Am I correct, sir? Hello, Mr. Folawi. Hello.
Hello, sir. I'm with you. I'm with you, sir.
I'm asking you. I said the right knee joint is the affected one now.
Yes, sir.
Good. So now this is still fair, but you are going to do something for me now. You are going to place him on that couch, face down.
Okay, he's on the couch.
Beautiful. Let him lie on his chest.
I should what?
Put him to lie on his chest. You have to play with him when you are dealing with children. Not like that. You have to play with him. It's a play thing. Give him something to play with. Do you have a phone there? Do you have a phone there? Hello, boy. It's not a military approach. That is one thing that you must know. Everything must be done in play. Everything you are going to do, you are going to wrap it in play.
Done.
Beautiful. You can even put him. You can put him on your. You see, don't worry. You can put him on your laps. You can put him on your laps. Put him on your laps. Big boy. Hello. Sorry. Now we put him on your. When he's playing.
Yes, sir.
I will show you something here. Joshua. So I will show you something here now. So that, yeah, beautiful. You sing for him as he's playing. You can put him on your laps. You know, look at this. I'm going to show you something on this pillow. But you will see somebody. Yeah. Okay. Then you're going to lie down. So it may not be convenient now for him.
Okay, sir.
Don't use the anchor block. And now you can see. Can you see this young boy here too? The way I'm placing him.
Yes, sir.
Can you see? Okay, good.
Yes, sir.
Now this is the right leg. Now move to the edge. Move down. Joshua, move down. Beautiful. This is the first thing. Now the edge of this couch, you can see the legs are free here.
Okay, sir.
Now you can have a soft material. It could be a towel, because you must prevent anything that will put pressure on that edge. Anything that will put pressure. You can just have a towel at the edge. Can you see me, please?
Yes, sir.
Good. So you put something here. Now, your boy will just be playing. You are playing. Note that for children, all the treatment must be wrapped and put inside play.
Okay.
You must play with them. Yes, it's not you have to do this. No, it has to be play. Without play, the main work of any child, any kid, is to play, and the main work of adult is to work. So their own work, anything you want them to do, put it inside play. If you don't put it inside play, you are not going to achieve anything with it. That's rule one. So placing him this way, what we just want to do is so simple. We want to use the force of gravity to stretch. Here is what we call, in our own time, is oblique fossa, but you can call it the back of the knee joint.
Okay.
This is usually what happens. Once you see them, they are like this. So the first step is to use force of gravity. Now, what you do in that sense, I will teach you two methods. For your child, that one is not too serious. Get a very small pillow because of his age and size. You're just going to put one here. A small, this one is big, a smaller pillow, please. Then you put here. Now, gradually you see, this is free. This end that is free, gradually gravity begins to take it down. While you are playing with that child, if you do this regularly, before the next month, the whole of this knee will be fully stretched without any complication. The second method is to make a wrap of towel, then with a hollow in it. So let me use this small towel. Now, if you wrap a big towel, you are going to have something here, a hole in that place. Now, once you have this hole, look at this. You wrap a towel like this. These are our own local approach and method developed over the years, and it has been working seriously. And I'm very sure before the end of this year, we will come to see all these in published articles, even with the WFH. So you make this like a ring or a donut. You can call it a ring or a donut. Are you seeing this? Are you seeing this too well?
Yes, sir. Yes, sir. Yes, sir.
Beautiful. So you just put this on the knee. So there is a hollow, a space for the front of the joint to rest. Look at it. You can bend this, Joshua. So you can see this. This joint, the front of the joint, will rest in this hole. Then you leave your child this way. Play with your child. For the age of your child, you can do an average play of 15 to 20 minutes. You are just playing with him. You are singing. Get what he likes or she likes. What he likes, then give him to be playing with. At the end of that first 15 to 20 minutes, let him play around. You can repeat this. Once you're around with him, you can repeat it 2 to 3 times in a day. Before next month, even that of your child that you are looking at will have stretched out completely without pain and without any. Hello, Mr. Folawi.
Hello, sir.
Hello. Do you get that?
Yes, sir. Yes, sir. Very, very clear, sir.
Okay, so let's move to.
Thank you, sir.
phone number.
So who was giving number 2?
Please.
Good morning, sir.
Good morning.
This is Mr. Kenneth, sir. Sir, really, I'm not at home now with the child, but with the little video I've seen, really, I understood it. Maybe when I get home, I will practice it with him, sir. He also has, well, initially he was having pains in the joint, but after taking some factors, realized that he's no longer feeling the pain, but that the swallowing has not actually calmed down very well, and he's helping while walking. So maybe I will try this method when I get home.
Okay. No, it's going to work. It's not a matter of trying. It's been tried and tested.
Yes, sir.
And we are still collecting data on it.
Yes, sir.
If possible, can we please get parents to maybe do a video when you are doing some of this exercise, so that we are sure you are doing the right thing.
Okay,
you can
sir.
do the video and then share if you want with Dr. Kareem and share with me, so that we can see if you're actually doing the right thing or if you need to be corrected.
Exactly. So we can do that now. Let's see.
Yes, sir.
Yeah, he said the child is not with him, so he doesn't.
It's when I get to. I am not around. He's not with me right now.
No problem. No problem.
Right, so
once you are doing it, and what you can do too is that as you are doing it, make a short video of it, and send, so that we are sure we are doing the right thing.
Yes, sir.
Once you've gotten the video, you can send to the ED. Then definitely it will get to me. Then we correct if we need to correct you. So because we want significant improvement this year in everything we are doing. So let me see another classical. Let's see somebody that is older than that our child.
Yes, I think
somebody that is older.
Yasin was on the call.
Older.
Who is here?
He's older. So let's see. Let's see on the video. Somebody that is older.
Turn on the video.
Sorry, I'm trying to turn on my videos.
Okay, no problem. Take your time. Then just let's
take
see.
your time. We can have someone else if your video.
Okay, can I show David now?
Okay, yes, Mr. Call, show David. Go ahead.
Okay, you can show David. Let's go.
All right.
This is the knee that was affected. That's really gone down with the help of the Libra.
Oh, it's looking better now. But this.
Okay. So let me see him. Okay. Hello, boy. How are you? How you doing? Good. Handsome boy. So you can stand up. Let me see you stand. Let me see you stand. Okay, just walk around. Just walk around. Rotation. Okay. Okay. So what I can notice here, I can notice two things. We're looking at one of the legs is externally rotated. I'm not seeing you again. Hello, your video, please. Okay, I can see you now. Now you can see the right is still there, still buggy. So we are still going to treat that because we don't want him to get into to the stage of synovitis. So when you look at this, the right is still bending. So we are still going to do a lot of this method is still going to work on the right. Then in the subsequent classes, I will now teach you as he's working. Let him walk. I'll show you something. Walk. Keep walking. So you see that as he's walking, especially it's a V, straight V shape. V shape. You see, as he's walking, turning the feet. Yeah, exactly. So that has to be corrected, because if this is not corrected, it will indirectly affect the knee joint again. So that is another class for another day. But for now, we are focusing on the knee joint. It will benefit
because
the right.
You can see how it stands. The leg is like V kind of.
Yes.
Affected.
This standing is to put that leg in a slight flexion so that it will not feel pain and it will not bear weight completely on it. So you see that this is called step standing. He has shifted the weight that the right one should bear, everything on the left. And as time goes on, if he continues this way, then this left leg, especially the left knee joint, will be overwhelmed. And that one will start having problem again. So, and that is the more reason we have to be on this one. What I've just done now is going to benefit from it.
Okay.
So the more he's doing that now, he will now be able to distribute the weight equally on both knee joints, so that the left joint will not be overwhelmed as time goes on. So part of it along the line is going to benefit from soft knee brace. That is what we call knee support this time around. It doesn't have any metal. It doesn't have any plastic. What it will have is rubber. It's going to benefit from that. Yes, it's going to benefit from. Yes. So as he's walking around with the support, and you are doing this exercise I've just shown you, you will see him. He will be very balanced.
Okay, sir.
Any other question, please?
Thank you. Okay, but it will help. You see now the thighs this one is thinner than this one, as you can see.
Yes, it will be thinner because that thigh is not working. The muscles there, they are not working. They are idle. They are not contracting. So while this one is overworking, it's like you going to the gym. You want to build up muscle strength and you want to build up here and there. You want to be more masculine. You are lifting weight. A time will come, what we call hypertrophy. That is the muscle will start growing bigger. So that one is putting more weight on the left. That is why that thigh is growing bigger. It's not putting any weight here. Yes. This one is growing thinner. So the first thing we have to address is the underlying factor. Why is he not putting weight on this right? Because one is afraid of pain. Two, because the strength level is getting, and three, the first thing is that he cannot stretch it completely. Once he cannot stretch this completely, he will not be able to bear weight. That is it. Yes. So let's go and stretch. Let's stretch it first completely. Then you now see naturally that place will start getting better, and the muscle block will be built.
Okay, sir. Thank you.
You're welcome. Yes. Okay, so now let's move. If we have any,
you have a more adult patient.
Yes,
adults now. Yes.
My son is about he's 11 years, but I don't know. My video is not starting. I've tried to press it several days. It's not working.
Oh. Are you using your phone?
Yes, it's my phone.
Okay, log out, sign out of the meeting and join back and try again.
Okay, ma.
And make sure when you are joining, you joined with your video and your audio both on. So
okay.
And join back and try it.
Okay.
All right. Do you have any other person maybe in your all from the hands?
Guys, good morning, doctor.
Good morning, ma. Good morning, sir.
It's Mrs. Doctor. Good morning. Happy New Year, doctor.
Yeah. Yes, ma'am.
Chair Mary, we've been doing that exercise. You showed us before. We've been doing it.
Okay. So, and have you seen any impact, any difference?
Yes, ma'am. Yes, ma'am.
Can we see the boy?
Can we see? Let's see.
Here he is.
I'm still seeing you. I'm not seeing him. So let's see the joints.
No. Come here. Don't go.
Where are you going?
See.
Let's see the joints.
Yeah. Can you see it? See it, ma'am.
Let him step back a little.
Okay. Oh, it's even my boy.
Yes, that's what she said. That you have told her about it.
That's my boy. No. Yeah, in fact, when it started, Okay, I think we have a video. Later, I will show. You can come now.
Okay, now come back.
But this is a good example too. When he came to me, when he came to Luke, he was using and he still has to use until that leg is fully stretched, because the leg will be fully stretched. Like I explained to the parents, they both came, that it's not a sprint. And I have to let everybody know, once you start this thing, it's not a sprint. Oh, it's not what you have to achieve within days. No. Remember, we don't want any other complication. Can you hear me, please?
I can hear you, doctor.
Everybody, this is going to everybody. Once you start all these exercises, you must not be in hurry to achieve that result. If you are in hurry, you are going to cause another problem. Oh. That is why over the years, by the grace of God, I've carefully developed this method so that while achieving the best outcome, we are not causing any problem. We just want that child to keep having all the benefits, and at the same time, without complication. That is our target. We don't want any complication. So once you start as parents, it's not that you should have achieved this, you should have done this. No, keep doing it steadily, gradually. That child will be excellent. It is tested, and it's a trusted method, which I've been collating data on for the past 4 years, so that by the time we are turning it out, it will become another novel approach in the management of musculoskeletal complications in people living with hemophilia. I think I will search for the first video I made for this boy. So all of us will now look at the first video, and we look at the first position. We can now look at him now. I'll tell the mother to place him on a couch. By there, I'm going to display that video. So I think I should have the first video. You'll see how bent that knee was then. And you can now compare now how better. So I'm assuring all of you, to the glory of God, that method is a tested and trusted. And I'm still collecting data on it. And hopefully this year, I'll be able to conclude on that research, and we can release it as a novel approach from Nigeria to manage musculoskeletal complications without creating any complication and without any pain, especially in our children.
Thank you, sir. Mrs. Zainab Usman, it's like your video is not working, right?
Yes, ma.
All right. So can doctor see your child?
Okay. Okay.
Leave
So, hello, boy. How are you? Let me see his face. How are you? How are you doing? Are you seeing me? If you are seeing me, wave to me. Wave to me. Oh, good. You are seeing me. That's better. So just walk around. Let me see you walk around.
Walk forward, let's
So you can see now, in his own case, move, keep moving. Keep walking, keep walking, keep walking. Beautiful. I can tell you from this that our boy is not only having knee, he's also having hip pain. Can you see that it's different from those ones that we have watched before?
There's hip there.
So now, because walking starts from the hip flexors, that is where we bend our hip, then followed by our knee. So in his own case, he's not bending the hip and he's not bending the knee.
Yeah.
So here, yes, that is what we are saying. For him, now he's a little It's going to be a bit different. Now we are going to, yes, we are going to concentrate on first movement of the hip. So let him go and lie down. We do the movement of the hip before doing this exercise. So let him lie down on his back, on that couch. No, on your back. Don't lie on your chest.
Okay, on your
Yes, on your back first. Now, you are going to bend your leg, the right, towards your chest, slowly. So let's go, slowly.
Slowly.
You can see. He's having pain?
Yes, sir.
Beautiful. Yeah, exactly. So the first thing here will be the pain. Yes, here we are going to deal with the pain management. So let me see. Let me show his face. Let me ask him a question. Where are you feeling your pain now? Touch where you are feeling pain.
Yeah.
Good. Then up there to, what about your hip? That place. Now, is the mom there?
Yes, sir.
Is the mom there? Yeah.
Yes, sir.
Don't bend the knee. Just carry the leg from the feet, from the heel. Put your hand on his heel. Yes.
By the ankle side,
slowly,
yes.
Yes, good. Just take it up straight. Don't bend the knee.
Okay, sir.
Keep taking it, and let me see. Keep taking it up.
If you have pain, let us know.
No.
No pain?
No, it's not. Yes, sir.
Beautiful. Take it up more. Take it up more. Good. Bring it down. Good. Now again up. Straight like that. Don't bend the knee now.
Okay, sir.
Don't bend the knee now. Down. So let's repeat that. Say 5 times. So count now. Let's count 5. Take it up straight.
Slowly.
All right.
More. Let's go. Except he's complaining about pain. More. Okay, down. Beautiful. 1. Let's go. 2. Down. Let's go. 3. Let's go. 4. Let's go. Then 5. Good. So now, where is he feeling pain now?
Where are you feeling pain?
Good. Now, leave they now tell him to move the foot, that right foot, up and down this way. Look at me. Like this.
Okay.
Your foot, your right foot. Beautiful. Yes. Move it. Count 20.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11,
12, 13, 14, 15, 16, 17, 18, 19, 20. Good. Now bend your knee a bit. Just a bit. Not too much. Just bend it small. Good. Take it back. Bend it small again. Bend it small. Beautiful. Take it back. Bend it small again. So, madam, you can see as it is now. Yeah, after this, go and get ice block for him. Put a small towel under his knee joint. Put a small towel there. Ice that joint for the next 12 to 15 minutes. Remove the ice and tell him to do this movement from the foot, from that ankle movement. He will do it. You will see that by the time he does it the next 2 times, he will be able to bend. It may not be completely to 90 degrees, but you will see that at least he can do 45 degrees. Little by little. There is nothing to rush about it. There is nothing to force about it. It must not give him pain at the end of the day. So ice it. After the ice, tell him to move. Gradually, you can see that before he was unable to bend at all.
Yes.
So now you can see that he's bending gradually. So all you need to do, don't overdose the exercise. Take it up straight, the way I instructed you 10 times. Yes. Tell him to move the ankle 20 times after icing. Then tell him to now bend the knee. Gradually, he'll start bending. Then the work so keep doing that for him. I'm very sure if you have any question or you are not so clear, do a short clip, get to the executive, Mrs. Megan. Then yes, I know I will get the information.
All right.
Any further question?
Doc.
Yes, ma'am.
How often should she do this? Once a day or twice a day?
At least this, well, for school days, we can still manage once every day. On weekend like this, you can do 3 times in a day.
Preferably
morning, afternoon, and evening.
And evening
That's
on
okay.
Saturdays and maybe Sundays.
Sundays, yes.
You can do it in the night before he goes to bed.
Yeah, yes, and it must be heist.
And you remember, and like like Nurse Florence always tells you people, whether there's whether there's physiotherapy or not, always ice the joints every night.
Yes, that's a form of prophylaxis too.
Yes, sir. Yes, I do.
Sorry, Doc. Can I get you right, please?
Okay.
As in continuously, just be icing the knee every day, or when?
Every day.
For now, especially when you are having. Especially when you are having challenge, especially now for this boy, he will be icing.
No, for my son, baby, that I showed earlier.
Yes, you can ice too. You can ice.
Okay.
But for that your son, max 10 minutes.
10 minutes, max, okay.
10 minutes.
Okay. Max.
Okay. So that the child is still stressing the joint every day.
For this boy, 12 minutes to 15 minutes. Minimum of 12 minutes, max of 15 minutes. That's it. Did you get that? Hello?
Yes, I did, sir.
Yeah, that's good. So we are still welcoming further questions.
Hello, sir.
Hello?
Hello, sir. Please, sir, I want to know, is there a need for a support for the child that, or the second person that called, that had this knee bleeding? Does he need a support like a clutch to hold on to?
Of course. You see, this one I'm giving you, like the first, the third one that you saw, when he was coming, in fact, I insisted that day to the clinic. He was formerly using a pair of crutches. So I have to change that pair of crutches to a walking frame then, because I discovered, we have our assessment. Now, before getting to all this stage, we do comprehensive assessment. We look at the child, we look at all other factors. Well, like I said, today is just an introductory aspect. So as time goes on, maybe there may be need for me to do other assessments, except for the fact that I may not be able to measure some things, but of course, I can get vital information from all of you. So even at times, we may need to give the child either a walking frame or a pair of crutches for the time being. Even when the child is not feeling pain anymore and is walking well, because we want to ensure complete healing. I want to prevent another episode of inflammation. So it is important, because that support is important. At times, we look at the child may need a support with just rubber. We look at the child may need a support with plastic inside of that support, some with aluminum. That is when the joint is badly damaged, so that we can have a balanced movement and a balanced posture. So we may need different types of support and braces. So that one too is very important. But we are just starting now. You'll be able, we'll get to the point that we'll be able to devote more time to each child in terms of both assessment and treatment.
Yeah, let me add to what Doctor has said. And that's the reason on this call, we have physiotherapists from some of our HCCs. And together with Dr. Kareem, they are going to come together where he will need you to go and see the physiotherapist in your center face-to-face for assessment. That time will come for you to know whether you are using crutches or anything. You must be assessed physically. It cannot be done virtually. So that's why we have our other physiotherapists here, and they are going to be working together so that if he tells you, maybe after a session like this, he can tell you, go and see your physiotherapist, and then he will have a discussion with the physiotherapist on what is best advice for you. So you can see he gave an example of an exercise, but when we saw another child, when we saw David, the same exercise did not work for David. It has to be a different thing. When we saw the other child, it has to be another different exercise. So these things are personalized, which means you have to be assessed individually. So you can't just say because somebody is using crutches, then you must use crutches, or somebody is using a bandage, you too must get that same bandage. Your own bandage, like you explained, could be a different type of bandage from what somebody else is using. And that's why we are getting other physiotherapists on board, so that you are closer to the person that can see you. Before we go ahead, I think our VP Medical has her hands up. I also want to use this time to welcome Dr. Kotila, who is also with us. We are welcome, Ma.
Thank you very much.
Go ahead, please, Tessie.
Welcome, Ma. Yeah, thank you so much. And thank you, Dr. Kareem.
You're welcome.
I just wanted to add my voice based on my experience with my patients. There's need for counseling, especially when it comes to telling a patient you will need walking aids because your knee is bad and you need it to rest. You don't need it to bear weight. Most times, some patients are non-receptive to that. So it is something that I'm happy that this is a mixed call. We have patients on the call. When you advise to use walking aids, it's for your own good and it's for the good of your joints. When you have hematopathy or when you have an acute bleed, the more you don't bear weight on that affected joint, the better for the healing, the better for the rehabilitation, and the better for you in the long run. So using walking aids is not a forever thing. And ED has talked about individualized exercises. It's not that Mamemeka went to physiotherapy and they gave him this exercise and they gave her this exercise for the son. There's no need for me to come. I might as well, it is the same hemophilia. I might as well use the one they gave Mama Emeka for my own child. It doesn't work like that. Everybody is assessed individually and giving the exercise that will be beneficial for their own joint disease or joint deformity. So this is what I want to add. Thank you and kudos, Dr. Kareem. I'm really enjoying this.
You're welcome, Prof. Tessie.
Thank you.
We have
further questions.
3 more people who have their hands up.
There's a question on the chat by one of the physiotherapists. I don't know whether you've seen it, so you can attend to it.
Okay, I'll check it now.
Chimeze, Yasir, and Michael. So let's go that way. So Chimeze, go on. Turn on your video, ask your questions.
Okay, I'm sorry, please. Let me quickly answer this question. There is a question that for how long will this, considering the fact that we are always talking about cryotherapy in acute condition. Now, good. We have acute condition and we have exacerbated condition. And once we have exacerbation, it presents like acute. So like in bleeding disorder, generally, once there is bleeding episode or there is re-injury, it is considered like an acute condition. Now, it is not a permanent icing. Now, as we go on, I will shed more light on that area. We talk about prophylaxis. We talk about prophylaxis in hematology, when the hematologist will see and say, okay, that is how we come about prophylaxis. Now, in physiotherapy, we've talked about prophylaxis too, that, okay, you don't necessarily have to wait for when bleed starts. In fact, I can remember in our last conference, we have gotten to the stage of sporting event as part of our routine for all the people living with hemophilia in Nigeria. No normal thing outside Nigeria, especially the developed clients. But here, that icing will have to be done, looking at what that, because they are children, they are going to play in school. You will not be there. They will play. Even without pain, they will play. So by the time they come back home, at times they will not even tell you. They will just tell you, I'm feeling. Once the aura is coming up, at least at home, the first thing is to ice. The only thing that we should be mindful of is the timing. For children, generally, I advocate 10 minutes with my experience, at least since 2014, that I've been working with people with hemophilia. For the adults, we can still be looking at 15 minutes to 20 minutes, depending on the presentation. And for the intermediate cases, not too fresh, not too long, I advocate 12 to 15 minutes. And I am still collecting data on all this time because we want everything that we are doing to be evidence-based so that we can come out and say, okay, if you highs for 10 minutes for the next maybe 2 weeks, once daily or twice daily, then you don't have any issue with this. With this case, if you ice for 12 minutes for the next 3 weeks, so for now, once that presentation is still there, the pain is still ongoing, and the bleeding is still being controlled, let us ice prophylactically for now. For the children, 10 minutes of ice will not do anything because they will have played before coming back home, except those of them that are on strict prophylaxis here. So I still understand some are on demand. Not everybody is on the full prophylaxis for now. So that's the reason. At least that will help at home for now before calling on the doctors and the others involved in the management. Have I answered the question, please?
Yes,
Hello?
doctor, you have. Yes.
Okay. So
thank you very much.
You're welcome. So the next person.
So, can we have Chimeze turn on your video? We have a few more minutes to go.
Good morning, Dr. Kareem. Good morning, ma.
Good morning.
I've been seeing videos.
Where is Chimeze?
Chimeze is here, ma.
He's the one that wants to talk. Don't talk. Chimeze is old enough to talk on his own. Go and sit down. Chimeze, take them. Come online.
Videos concerning about younger kids, but for teenagers like him.
Hello, please.
Know what to...
That's why he said, let him talk. Let Chimeze talk, madam. He's the one that can tell us what is wrong. He's old enough to talk. Where is he?
Hello, Chimeze. How are you? I'm not hearing your voice. Can you see me? Yes. Okay, if you can see me, just wave. I'm waving to you. Just wave to me too. Okay, you can see me. So tell me what you are experiencing. Where are you feeling pain? Tell me what your challenge is.
It's about my left leg.
Your left leg?
Yes, sir.
So let me see that your left leg. Show me that your left leg. Okay. Put the camera well. I'm not seeing it well. Okay. Can you stand up? Stand up. Let's see you stand first. Okay. No. Just lower the camera. Go down, go down, go down. Good. So you are going to walk. Let me see you walk. Let me just see you walk. Walk. Keep walking. Walk. Let me see you walk. Okay. Yeah, I've seen that. So now tell me, what are you experiencing?
Experiencing pain.
What?
Pain.
From,
Experiencing pain.
you are feeling pain.
Yes, sir. And I can't stretch it.
Under your knee or on your knee?
Under my knee.
Under your knee. So you see, at this stage, this is a synovitis stage. How old are you now? Please.
20,
okay. You see now, this your face is a synovitis stage. Now we need a lot of work on this your knee joint. Now, how painful is this pain? Now let's do it this way. Just give me an idea. Are you hearing me?
Yes, sir.
Now, if we say 0 is no pain at all, and we say 10 is the worst pain you can feel. Now, from 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, what number will you choose to represent the pain you are feeling on this your left knee joint?
8, sir.
8.
8.
8.
Yes, sir.
Okay. Now, when last are you on Emilibra or you are? Which one are you on?
Not on Emilibra.
It's on regular factors. It's on
regular factor. Okay.
Yes.
Well, with that, bros, you are going to heist very well. Then I think maybe after this lecture, we are still going to get in touch because at this phase of synovitis, you are going to do some things that I will highlight for you. Maybe I will need to send.
It's in Lagos. You can come
it's in
and
Lagos.
see.
Then there's no
come
problem.
and see you. It's in
You
Lagos.
come and see me. Then that's easy. So just come and see me.
Okay, sir.
Come to let me know. Get my phone number. My phone number should be online. Call me, then I'll give you appointment. So I'll see you, assess you then. We take it off from there. This is synovitis, and we have to really do a lot of work before we now move to serious arthropathy. So just try and get in touch as soon as possible.
Mommy Chimeze, Ma, your assignment is to call Dr. Kareem on Monday and book an appointment. I want to know the date for your appointment.
All right, ma.
So
it's okay, ma.
All right. You're welcome. Okay, before I go to Michael, we have one of our physiotherapists in the room with his hands raised up. Please, Dr. Ibrahim, you have the floor, sir.
Okay, thank you, ma. Good morning, sir. Good morning. Good morning. So I did the first time I'm joining your meeting, and I really appreciate it. Thank you so much for the effort. The question or the contribution I want to really mention. So how do you consider maybe like including pendular exercise?
Well, yes, pendular is part of it, but it has a stage. Like I said in the beginning, there is a guideline for managing all these patients. We have a guideline, and as much as possible, we are doing what is called multidisciplinary approach from the hematologists to the nurses, physiotherapists, and our counselors too, so that with social workers like that, and a lot from our ED too. because she's been playing serious role of that counseling unit. You know, she's been doing a lot, and the education. So pendular exercise is there. But like we usually say in bleeding disorder, that when you say, is this exercise good or not good, or is this one harmful or not harmful? The answer is, it depends. It depends. After the assessment, in line with the guideline, then we take decision for the treatment, and we see excellent results. So as you move with us, you will go through the training, you will learn all these guidelines, and you start implementing it on all the people with hemophilia, and you see a big difference. So pendular, there is a place for pendular exercise.
Exactly. Thank you so much. I appreciate it. Thank you.
You're welcome.
Thank you so much, Dr. Ibrahim. I'm so glad to have you from Udus on the call. Michael, I think you are the next.
Karma.
Dr.
Kareem.
That's the only Yoruba he knows.
At least I don't try. I don't try.
Something.
All right. Good morning, doctor.
Good morning. How about you?
I'm fine. The issue is about my knee.
Okay.
If I sit on the floor here,
okay,
here will not go down.
Yes, well, I've gotten that. Right. That will not be fully stretched.
Yes.
Yeah.
So for you, that exercise that I described earlier on, you are going to benefit from it. But in your own, you are going to add weight. You are going to lie down on a couch or even on your bed.
Before you continue with him, I don't know if you know his full story.
Well,
he's not telling you the full story why there's so much weight on that leg. Actually had an amputation on his right leg.
Okay.
So all his weights are on
it's
that
on this
leg.
one, yeah.
Is on this one. And there was a time that the prosthesis was giving him problem before he changed it. So there was so much weight on this left knee. And I told him that time, because the prosthesis was bad, it broke in between. So all his weight was on the left knee. And I think that was when this left knee also started developing a problem. And then he started having issues with the left knee again. So that's the thing about his case.
Thank you, ma, for the background information. Even as at that, even with this, but you now have a good prosthesis.
Yeah.
Hello, sir. You now have
confident enough.
Yeah. So even with that, that exercise will still be beneficial for you. But now, because we have to stretch the hamstrings, we have to stretch the hamstrings. So at that place, at the back of your knee, called popliteal fossa, the soft tissue around that place, they have to be more flexible than this. So when you are going to benefit from that exercise, or you must look for a couch or your bed, but you are going to add weight. Now, with this I'm seeing for now, where is your region?
I'm in a
South, Port Harcourt.
You are in, okay.
That's
South. That's South. Okay. Yeah. So with the help of a physiotherapist there, I think we should be able to assist you very, very well. So we can test out weight, because I don't want you to have any complication from the stretch. Very simple. You have a hollow towel on your knee, and we can start with 1.5 kg weight to 2 kg. So as time goes on, you keep increasing gradually. The only thing is that if we start with 2 kg, the time may be a bit longer. So as we are increasing the weight, we'll be shortening the time. Do you get me now? So that place will now be able to stretch out very well. And that will even help you too, because you are on a prosthesis. So it will further help you. So for your own case, in conjunction with one of the physiotherapists over there. We can have a video chat like this. I'll describe what's to be done to the physiotherapist, and you start doing it on daily basis. Very short exercise. It's not going to take your time, but it's going to be very effective for you. And there is nothing to rush about it. Just take it easy. As you are doing it, you'll be getting your results.
Thank you, doctor.
You're welcome. So any further question, please?
Do we have any questions? We are right on time. Do we have any other questions, general questions? Okay. If we don't have any questions, just to recap what we have done today, we have said that for the next 3 months, we are going to focus on the lower limb, and we're starting with the knee. And what we are doing now is how to stretch those knees that are already in a flexion position. Whether you have shown your knee today or not, you know better if your knee is in a flexion position. And I want to advise that the simple exercise that was given today, we do it for the next 4 weeks before our next class. Like we said, you can do a short video and on how you are doing it, so that we can see and be able to correct you if there needs a correction, or to what you are doing right. I want to once again thank all our HTC directors who joined, from Dr. Agunbiade from Ogbomoso, Dr. Kotila from Ibadan. Thank you all for being here. I want to thank all our physiotherapists who are joining us for the first time, and those who have already been part of us. I saw someone asking how you can join the WhatsApp group. You can just reach out. If you are from any of the HCCs, reach out to the HCC director that gave you the link, and then you get the link to the WhatsApp group of your chapter as well as the national WhatsApp group. Dr. Kareem is going to create a specific group for hematology. I'm putting my number on the chat box for those who don't have it among the new physiotherapists joining us. Send me your number so I can forward to him, so he can add you to the physiotherapy group. That's going to be mainly for physiotherapists, for you people to have your own discussions on how we can develop our own programs and our own activities going forward to better help our patients. Bolaji, I asked you if there was a question. You didn't raise your hand. You are raising it. I'm giving you 1 minute. What's your question?
Yeah, good morning, ma. I'm sorry, I actually joined it, so I just wanted to know the exercise that was being given for people to do. That's
the video,
why.
The meeting is recorded. It's got people like you that will record it. And once I download the recording, I'm going to put the link on the HCC, on the HFM page. So for those who did not see it, you can watch it and see the exercise on that page. I hope that answers the question.
All right, thank you, ma'am.
All right, so thank you, everyone. Thank you for joining. It's the beginning of a new year, and we're going to do better to serve this community better. Look forward to seeing everyone on the 11th of February, same time, 10 a.m. Mark your calendars. It's going to be a monthly thing, and I'll see you next month. Thank you, Dr. Kareem, for your time. Thank you for your commitment. Thank you for everything. Enjoy the rest of the weekend. Bye, everyone.
Bye.